Picture this for just a second. It is a calm Tuesday morning. Margaret, a 72-year-old widow living in Ohio, pours herself a cup of coffee and begins opening her mail. Inside one envelope, she notices a thick packet from her Medicare Advantage provider. She quickly looks at the front, notices the phrase "Annual Notice of Change," then places it off to the side. She figures she can read it later. After all, her coverage worked perfectly fine last year, so surely it should still be fine this year, right? 3 months later, during the first week of January, Margaret arrives at her doctor's office for a routine arthritis appointment. The receptionist glances at her computer with concern and softly says, "I'm really sorry, Margaret. We don't accept your plan anymore. You'll either need to pay the full amount today or locate another physician." Margaret immediately feels sick to her stomach. Her hands begin trembling. She starts thinking about her heart doctor, her pharmacy, and the medicine she absolutely depends on. What if all of those changed too? She tries to switch to another plan, only to learn that the enrollment deadline already passed. In a single moment, Margaret realizes she overlooked something critical, and now she is trapped for an entire year. If you are watching this video, please do not allow this to happen to you. I am June, a senior policy analyst who has spent many years helping retirees safeguard their benefits, pensions, and healthcare coverage. Today, I am going to explain the exact Medicare Advantage changes arriving in 2026, the steps you absolutely must take before open enrollment ends, and the federal Medicare rules that quietly changed under the new law. And please stay with me until the very end, because there is one hidden mistake millions of retirees make every single year. One mistake that can block access to your benefits for 12 complete months. I will explain it before we finish. Let me tell you about Robert. Robert is 68 years old. He is a retired postal employee from Texas, a hard-working man who watches every dollar carefully. He always paid his bills promptly. He had a Medicare Advantage plan he genuinely liked. The premium was $0. It included dental coverage, vision benefits, a small over-the-counter allowance for vitamins, and even monthly grocery assistance because he had diabetes. In September 2025, Robert received his annual notice of change in the mail. He saw the large booklet and thought to himself, "I already trust this plan. I don't need to read all of this." So he tossed it into a drawer. October came and went, then November, then December. On January 1st, 2026, 3 major things happened to Robert all at once. First, his grocery allowance vanished completely. The federal pilot program responsible for funding it, known as the Value-Based Insurance Design Model, officially ended through Medicare on January 1st, 2026. More than 7 million low-income seniors lost those exact benefits overnight. Second, his diabetes medication was moved into a higher pricing tier. His new copay became 4 times higher than before. Third, his trusted endocrinologist was no longer considered in-network. Any future visit would now require paying full cost. Robert called his insurance provider begging for help. The representative politely told him, "Sir, the deadline to switch plans was December 7th. There is nothing we can do now." Robert was locked into that situation for the rest of the calendar year. I am telling you Robert's story because I do not want it becoming your story. So now let us go over exactly what changes are coming in 2026 in simple everyday language. The very first and most important dates are October 15th through December 7th. This period is called the Annual Enrollment Period, and it is established by federal law. This is your primary opportunity every year to join a Medicare Advantage plan, change plans, cancel your current plan, or modify your prescription drug coverage. If you miss this deadline, you generally must wait another full year. There is also a second enrollment period running from January 1st through March 31st. This is known as the Medicare Advantage Open Enrollment Period. But here is the critical detail many people never realize. This second window only applies to people who are already enrolled in a Medicare Advantage plan. If you currently use Original Medicare, you cannot use this period to enroll in a Medicare Advantage plan. And this second window only allows one change. 1, not 2, not 3, only 1. Now let us discuss the actual 2026 cost changes because these are official numbers released by the Centers for Medicare and Medicaid Services. The standard Medicare Part B premium is increasing to $22.90 each month. That is almost an $18 increase compared to the $185 amount in 2025. The Medicare Advantage in-network out-of-pocket maximum is now $9,250 annually. That means in a worst-case situation, you could owe as much as $9,250 in in-network healthcare costs during the year. And please listen closely. If your plan is a PPO and you seek non-emergency care outside the network, that spending limit may not apply whatsoever. You could end up facing unlimited medical expenses. There is also some good news. The Part D prescription drug out-of-pocket limit is now capped at $2,100 annually. Once you spend $2,100 on covered medications, you owe nothing more for covered prescriptions during the remainder of the year. The highest possible Part D deductible is now $615. Insulin costs remain capped at $35 monthly or less. And recommended adult vaccines covered under Part D are now free without any deductible. There is also an entirely new federal protection included under the 2026 Medicare Advantage Final Rule. If your insurance plan approves an inpatient hospital stay, the plan cannot later reverse that approval except in cases involving fraud or obvious error. This is a major victory for seniors who previously received surprise bills weeks after leaving the hospital. Now, I need to mention something extremely important for viewers living in 6 specific states. If you live in Arizona, New Jersey, Ohio, Oklahoma, Texas, or Washington, Original Medicare is beginning a 6-year prior authorization pilot program in 2026. That means even people using Original Medicare may now need pre-approval for 17 specific medical services. This is brand new, and many retirees are being caught completely off guard. I also want to warn you about something reported by the Kaiser Family Foundation in their 2026 Medicare Advantage Spotlight. Many insurance plans are quietly cutting extra benefits. Over-the-counter allowances dropped from 73% of plans down to 66%. Meal benefits fell from 65% to 57%. Transportation benefits dropped from 30% down to 24%. So the plan that gave you a generous OTC card last year may have reduced it dramatically for 2026. You will never know unless you carefully read your annual notice of change. So now let me give you the 3 exact steps you need to take immediately to protect yourself. Step 1, locate and read your annual notice of change. Federal law requires this document to be mailed by September 30th every year. It explains every change affecting your plan beginning January 1st. If you cannot locate it, call your insurance provider immediately and request another copy. Do not skip this step. This document is your official early warning system. Step 2, visit the official Medicare website at medicare.gov and use the Plan Finder tool. For the very first time in 2026, the Plan Finder now shows which doctors are in network for each available plan. Enter your doctors, your hospitals, and every prescription medication you currently take. Compare your existing plan against at least 2 competing plans. And remember this important detail. If a plan directory incorrectly lists your doctor as in network, there is now a special enrollment period allowing you to switch plans during your first 3 months. That is a completely new protection introduced for 2026. Step 3, seek free unbiased help from your State Health Insurance Assistance Program, commonly called SHIP. This is a federally funded counseling service. They do not sell insurance plans. They do not earn commissions. Their only job is helping you. You can locate your local SHIP counselor by visiting shiphelp.org or by calling 180-MEDICARE at 1-806-334227. You can also contact AARP, which provides free Medicare assistance to seniors nationwide. Now, before we finish, I promise to reveal one hidden mistake that costs retirees their benefits. Here it is. Most seniors assume that if they do nothing during open enrollment, their plan simply remains unchanged. That is one of the most expensive misunderstandings anywhere in Medicare. Doing nothing does not mean preserving your current benefits. Doing nothing means accepting every single change your insurance company introduces for the next year. Higher copays, doctors removed from the network, new prior authorization rules, smaller medication lists, reduced extra benefits. Silence does not protect you. Silence means agreement. And there is something else many people overlook. If you enrolled in the Medicare Prescription Payment Plan during 2025 and then switch to another prescription drug plan for 2026, your monthly payment arrangement does not automatically carry over. You must enroll again with the new plan. If you fail to do that, You may suddenly face the full cost of your prescriptions during your very first pharmacy visit in January. My friends, please hear me clearly. Do not depend only on YouTube notifications to stay informed about your Medicare coverage. YouTube is not the government. We work hard to provide accurate information, but regulations change, deadlines shift, and your individual insurance plan may contain details that only your official mail and the Medicare website can verify. Visit Medicare.gov today. Call 1-80-MEDICARE. Contact your local SHIP counselor. Read your annual notice of change. And if you know a friend, neighbor, or family member on Medicare, please send them this video. One conversation could save them thousands of dollars and protect access to the doctors they know and trust. This is June reminding you that your benefits belong to you. Your voice matters, and the small actions you take today can protect your peace of mind tomorrow. Take care of yourselves.